Good evening, everyone. On the behalf of Team DentistChannel.Online, I would like to extend a very warm welcome to all of you. I am Dr. Aditi Mishra, and I'll be the host for today's session on the topic Bursting the Myths in Pediatric Dentistry by Dr. Purva. So before starting the session, I have few housekeeping notes to make. If you have any doubts within the session, you can ask your doubts and put your question in the question and answer box in your control panel, and each and every question will be taken up at the end of the session. This webinar is sponsored by Simpladent Implants India. So without further ado, I would like to introduce our today's speaker to everyone. Dr. Purva has done her B.D.S from A.C.P.M Dental College Dhule and M.D.S from Pediatric and Preventive Dentistry from VSPM Dental College, Nagpur. Over to you, ma'am.
Thank you, Dr. Aditi.
We can start the session now, ma'am.
Yeah, okay. Good evening, everyone. Hope I'm audible to you all. Myself, Dr. Purva Khanapurkar Bakre. I am a pediodontist practicing in Nagpur. Now, pediatric dentistry is a branch, well-established branch. People are now becoming aware of it, but still many people are hesitant because of the myths surrounding the topic. This is mainly because of the lack of knowledge and awareness amongst the people. So today I am going to burst these myths in pediatric dentistry. Now the first myth is that milk teeth, tooth decay and cavities in milk teeth don't matter. First of all, milk teeth are very important for the development of jaw and face. The milk teeth are like the foundation of the face. Whatever the child is eating the food, he gets the nutrition from that by chewing the food. If the milk tooth are carious and the child is in pain or discomfort due to this decay or infection, it will hamper the health of the child, as he will not be able to chew the food properly and he will not get the proper nutrition. Secondly, milk teeth without any decay, that is healthy milk teeth, are also important for the growth of permanent teeth. The permanent teeth grow in place of the primary teeth. If the primary teeth are decay or infectious, then the placement of the newly erupted permanent teeth will be off-centered and crowding will occur due to that. Also, if the children are having carious teeth and they go to school with blackened teeth, they may get ridiculed because of that, and this getting ridiculed may affect their confidence. So having a good smile with healthy teeth help boost confidence of the child. Now the second myth is that kids don't need to see their dentist till their permanent teeth grow. Here comes the concept of child's first dental visit, which should be when the first tooth erupts or by his or her first birthday, whichever comes first. Now I say this because the time for eruption of the first tooth is from 6 months to 12 months, 8 to 10 months. This may be delayed in some kids. So whenever the first tooth erupts or by his or first birthday, the child should get his teeth checked. Why should we do this? To intercept any abnormalities seen in the child's teeth. Now this also the dentist can explain the parents proper oral hygiene measures in order to prevent or minimize the risk of caries. Like some children are at a higher risk of caries, so the parents can be made aware of that, of the preventive measures which they can take to reduce the risk of caries and to check for for any abnormalities the child may be having. The fifth myth is that there is no need to clean the milk tooth. The tooth needs to be cleaned even before the milk tooth erupts. That is, the mouth, the gums can be cleaned after every feed with a soft gauze wrapped around the finger. After the tooth erupts, clean it with a finger brush to help remove the layer of plaque, which is the sticky layer which gets accumulated on the tooth surface, and it contains caries forming bacteria. So after every feed, you should clean your child's teeth with a finger brush. When the child can hold a toothbrush at that time, the parent should help child brush the teeth until they can do it by themselves. And after that, until the time when they can spit it by themselves, the parent should supervise the brushing technique. The brushing should be done twice daily, in morning and afternoon, after night, before sleep. For special children or children who have difficulty in dexterity movement of arms, battery operated toothbrush are available, which help in proper cleaning of the mouth. Now, myth number 4 is flossing isn't necessary. See, the area in between the tooth is the most tricky area where the food gets stuck, and the food cannot be removed by proper brushing or even by gargling. That this food gets stuck causes interdental caries, which is the most common site. The flossing with a floss or thread helps in removing the food stuck in between the teeth. So regular flossing helps minimizing the risk of caries in between the teeth. The fifth myth, which is very important, is that cavities are inevitable. See, every child has a different caries risk prone. Tooth decay can be prevented if following tips are followed. First of all, proper cleaning of teeth and mouth. Oral hygiene measures has to be maintained properly. Second is avoiding sharing utensils between the mother and child or the siblings. If the mother has a higher caries prone bacteria in her mouth, or the siblings have higher caries risk, and we use the same utensils, the shared utensils, or even if the child is in daycare where sometimes utensils can be shared, that time caries causing bacteria can be transferred from the mother or the sibling to the child, and thus increasing the caries risk. So avoid sharing used utensils. Third is proper diet consultation. Now, what is the diet consultation is, we have to know proper balanced diet if the child is getting or not, and what is the gap in between each meal, or in between the meals if the extra sweet is being given, and what is the gap in between two sweet food taken between the child should be. So that helps that is the proper diet consultation which a pedodontist does. So you should ask your pedodontist to give you a proper diet consultation chart to reduce caries risk. Also ask your dentist about caries preventive treatment, which is fluoride application and Pitt and Fisher sealants, which can arrest and prevent the forming caries. Also, an important tip for parents and dentists also is that the caries is not appearing as a blackish discoloration at first. The caries first appears as a whitish discoloration of the whitish patch on the tooth. If you observe properly after drying the tooth, or whenever you are brushing after drying the tooth, if you see white patches on the tooth, take your child to the dentist and get it treated. That patch itself, the caries progression can be arrested at that same time. Myth number 6 is habits don't affect baby tooth. Children may have one or another habit of the following, that is thumb sucking or digit sucking, nail biting, lip biting, mouth breathing, tongue thrusting. These habits, if continued even after 4 years of age, have a bad effect on the teeth and jaw development. Children easily otherwise can break the habit themselves. But if they are not able, they can be coaxed to give up a habit by making them understand its effect, or even by proper counseling. But if the habit is deep rooted, like the child is sleeping with a thumb in his mouth, or for sucking the digits for a longer period of time, and the child is not able to stop himself or herself, then habit breaking appliance can be given, which will help the child stop and break the habit. After the habit breaking appliance habit has been broken, the effect on the dental jaws and teeth can be treated. Now, seventh myth is that for caries milk teeth, extraction is the only option. Now, caries is a progressive disease, and various stages of caries are there. When caries reaches the pulp and it causes inflammation and infection in the surrounding tissue, which leads to primary root resorption, which can be seen on the dental X-ray. Here it can be seen that the caries has progressed to the root. Then only the tooth needs to be extracted. If the caries is at different stages and not causing any pain or discomfort or infection to the child, the teeth needs not to be extracted. And many treatment options are available to save the carious teeth until the time of their exfoliation. If at all the tooth has to be extracted before the age of exfoliation, and the time for the permanent tooth to erupt is more than 6 months of age, here you can see that the permanent tooth has a long time to erupt. So space maintainer has to be given. If the space maintainer is not given to maintain this extracted tooth space, then the tooth adjacent to the extracted space will close the gap, and the permanent tooth which is erupting from here becomes stuck and can erupt from buccally or lingually, resulting in crowding. So a space maintainer is a preventive treatment which after has to be given based on the development of the permanent tooth. Now, myth number 8 is that dental treatment is always painful. The main fear for the treatment of kids is fear of needle, because child is getting vaccinated by the pediatrician. So, and also from the stories they have heard from their parents that it is always painful. You will get big injection if you don't brush and all. So, newer techniques, that is needle-free injections, or even now conscious sedation has been used regularly, which helps in elevating the pain of the child and thus makes the treatment bearable to the child. A very important factor in elevating the pain and fear of the patient for a dentist is to build a good rapport with the child and his or her parents. So do not rush to treat the kid. Invest time in building the rapport, and the outcome will always be very good. Also, now parents due to COVID are very afraid of taking the child to a dentist, but make sure that if the kid has very severe pain and infection, to take your child to the dentist always uses all protection gears and some oral hygiene measures to do at home, that is like proper brushing technique, as I told. Kids gargling methods are used 5 years of age, like Listerine or Colgate, which helps in removing the bacteria. And for younger age, you can give salt in the water to gargle and ask the child to spit it out. Also, flossing, and a very important thing is that brushes has to be changed every 3 months. And if any parents or any other member of the family has gotten some infection like flu or corona in these times, change the brushes immediately after you get infection free, and use a new toothbrush, and keep everyone's toothbrush different so that the infection cannot cross, because we cannot make in the house. So that's all for today for busting the myths. Hope all your myths I have cleared, and there is no hesitation for anybody to take a child to a pedodontist and make your child caries-free, happy, and give them a healthy smile. Thank you.
Thank you so much, ma'am, for these amazing mythbusters. And I hope our all the participants would have learned and would be using all these in their practice. So, meanwhile, I will ask for your permission to introduce our company to all the participants. And I request all the participants to kindly put their questions in the question and answer box if they have any, so that we can take up the questions in the question and answer round. But before that, I'll be introducing our organization to all the participants. Kindly allow me. So this is our organization, DentistChannel.Online, with the motto Healthy Smiles that lead to wealthy lives. I request all the participants to kindly save this number and send a message on this number so that you're added to the broadcast list and you are updated regarding each and every upcoming webinars or workshops that we have. Like I have mentioned, today's webinar is sponsored by Simpladent Implants. Immediate functional loading implantology is one of the dynamic and rapidly developing areas in oral healthcare, especially in recent times. In addition to the fact that more and more patients can't wait to get fixed teeth, the demand in the COVID disease scenario have increased the relevance of minimally invasive immediate load implantology with minimal surgical and prosthetic intervention. Strategic corticobasal implantology is unique in that it offers immediate loading implants, and Simpladet has been pioneer in establishing this science in India and emerged as a business leader in marketing and distribution of corticobasal implants in India. Simpladent has an array of implants all designed for immediate functional loading concept and delivering fixed teeth within 72 hours. Now, quickly going through the upcoming webinar for this month. So tomorrow at the same time, 7 o'clock, we are having a webinar on TMD diagnosis by Dr. Megha Behel. So kindly join in the session. So, and you have any doubt or anything regarding any webinar or workshop, you can contact on this number, or you can visit our website, events.DentistChannel.Online. If you haven't subscribed to our Prime membership even now, I request you to do it ASAP so that you get all the added benefits. To become the Prime member, you need to pay the annual membership will cost you 499 rupees. Kindly visit our website www.DentistChannel.Online. You can follow us on Facebook, Instagram, Twitter, and YouTube. Now moving on to the question and answer session. Okay, so ma'am, we'll be starting with the question and answer session now.
Yeah, sure.
Okay, so first question is from Dr. Kamal. He's asking, could we just obturate with the zinc oxide eugenol cement in the deciduous tooth? Is it fine?
Just a sec. Yes, actually, zinc oxide eugenol is the most commonly and most preferred, used from a very old time as a obturating material in primary teeth, deciduous tooth. Just we have to clean the tooth like a normal BMP we do in normal tooth, and obturate with the zinc oxide eugenol cement.
Right.
Then newer technique, Metapex and Vitapex are the materials which are used, but zinc oxide eugenol in cases where it helps basically when you are not sure if it will resorb on its own, and if there is a risk of infection, and then Metapex is usually used nowadays, but zinc oxide eugenol is used always from older times.
Next question is from Dr. Unnati. She's asking, what is Shake's pulpotomy?
Shake's pulpotomy is done in traumatized tooth, permanent incisor, where the root formation is not complete, like in 7 years it has just erupted and root formation has not yet completed. At that time only the pulp, we remove the infected, that is the which has been injured. We do a partial pulpotomy, remove the pulp so that the pulp is vital, remaining pulp remains vital, and it will help in proper root formation naturally. So calcium hydroxide paste is placed on the remaining pulp tissue, coronar pulp tissue, and the tooth is closed with an aesthetic restoration.
Moving on to the next question from Dr. Sandhya. She's asking, can we use pulpotectomy in cases with pulp involvement for uncooperative patients? Can you please tell us the method to use it?
Yeah, in uncooperative patient, like I lastly said, you have to first of all gain the trust of the patient. It is very difficult to do in an uncooperative patient in private private clinics, because the parents are very much, the child is very much adored by the parents, and they are very much skeptical about harming the child and everything. So just gain an access to the cavity, pulp cavity. In the first visit, just do a 2-minute job, get access to the cavity, open the cavity, and just spend the time gaining trust of the child. Also, you can use cartoons and give the child positive enforcement like stickers and everything, and ask the child about his or her favorite cartoons, and you can show them in the next visit and give positive enforcement gifts to the child. And if eventually the child will become cooperative. Otherwise, you have to obtain the consent of the parent that you have to use force, and you have to use forehand dentistry, like we say, and do it under force if the child is not at all cooperative. And the last option, if the parents agree and are payable, is better way is to do under GA if the caries is much caries teeth are there. So to prevent the child from going under a traumatic treatment and forcement, then under GA, if the parent is available and you have the all necessary surgical team available, you can do the treatment under GA.
Moving on to the next question by Dr. Akhil. He's asking, antibiotics and analgesics which are given for certain age group 1 to 5 years, 6 to 10 years, and so. And what will be the dosage?
Antibiotics, amoxicillin is given. We generally give according to the weight. It is important, not on the based on age, because every child weight is different. So antibiotic, which is I normally uses augmentin duos, which is based on the weight. 1 to 5 years, I'll prescribe 3 ml, and above that 6 to 10 years, based on the age, around 5 ml twice daily. And analgesic is ibogesic plus.
Moving on to the next question by Dr. Ankita Khare. She's asking, which mouthwash and floss will be good for children?
Yeah, mouthwash is Kidodent or Listerine. Kidodent mouthwash is available, or it's Colgate also mouthwash is available. But generally the mouthwashes, they are saying above 5 years of age, because before that the child is not able to generally spit properly. So mouthwashes are generally asked for the children above 5 years of age.
Right.
Kidodent or yeah.
Okay. So next question is from Dr. Sandhya. She is asking that material Pulpotech can be used in children, the uncooperative children, and the technique to use it.
Okay, Pulpotech, yeah. Just hold on. Pulpotech I have, yeah, I have, but I'm not actually technique. I'm not entirely sure about it. I'll just.
Okay, meanwhile, moving on to the next question. Anyway, Dr. Purva can, Dr. Sandhya, your question will be answered and Dr. Purva will definitely get back to you very soon. So moving on to the next question.
I'll just be back. There is a question in the question answer. I'll just get back to you in 2 minutes. 1 second.
Dr. Chandana is asking if the patient is not supportive for treatment, how to manage that case.
First of all, manage. You have to convince the patient properly, because what patient have various, like I said, myths and misconceptions that it will harm the child's eyes, or the injection can harm the child. So we have to make them sure and take them into confidence that the treatment is safe. We have to convince them thoroughly, and also that it can be, if the patient is then convinced, then the child is also have to be explained the treatment, like tell show do you can use tell show do technique. It helps the child getting the confidence that whatever he is being undergoing has been explained to him, so he will not be taken by surprise by any sudden sounds or movements.
Moving on to the last question for the evening. How to sterilize toddler's toothbrush and what toothpaste to be used for age younger than 2 years?
Now many, if you see on many web shopping sites, like if we see First Cry, there are toothbrushes and there is a kit available which comes with a sanitizer is available. It can be cleaned by steam also. You place it in a steamer, the toothbrush, and it can be cleaned. And for the toothpaste, any fluoride containing toothpaste like Kidodent or Cheerio toothpaste is there. It can be used for a child younger than 2 years of age. Just a piece, small smear of the toothpaste has to be given, not a large amount. Smear of a toothpaste on the brush has to be given.
Right. So, any fluoride-free toothpaste you would suggest?
Fluoride-free toothpaste I'll suggest is Cheerio. One Cheerio is there, or else Cheerio brand is there. It has both fluoride and non-fluoride also. Then also Mamaearth toothpaste is there. Mamaearth product is also there, which has non-fluoride contains.
Okay. So with this, thank you so much, ma'am, for the webinar. And I'm sure all the doubts for all the participants have been cleared by now. And looking forward for more webinars with you. Thank you so much for being with us today.
Thank you so much. Thank you everyone for listening. Thank you. Have a good evening.
Thank you to all the participants for being with us. Have a great evening ahead. With this, we are ending the session. Thank you so much.